We begin with swine flu, now widespread in 46 states. President Obama has taken steps to ratchet up the response. Officials hope the move will give the government the authority and flexibility to react to a virus that continues to confound the medical community. ABC's Rachel Martin joins us now from the White House this morning. Good morning, Rachel.
Good morning, Kate. The White House says this is a proactive move to make sure hospitals and local governments can respond swiftly, rather than a sign that the crisis is deepening. Still, it is now official. Swine flu is a national emergency.
The president's declaration is straightforward. The 2009 H1N1 influenza pandemic in the United States constitutes a national emergency, and the potential exists for the pandemic to overburden healthcare resources.
This epidemic is continuing to progress, and more people are going to emergency rooms, more people are going to hospitals, and sadly, more people are dying.
White House officials say the declaration isn't linked to current infection rates. Instead, they say it's a proactive move that allows the Department of Health and Human Services to waive some federal regulations so healthcare providers can better fight the epidemic.
The American people shouldn't panic about this. Okay. This is really not about a statement that things are a lot worse. This is really about this government doing every single thing it can do to be prepared.
Calling the epidemic an emergency now allows hospitals to treat it like one.
Hospitals that will put tents outside their emergency rooms so they can kind of triage patients, separate the less sick from the really sick. And I think we'll see some institutions go out and set up satellite clinics in places that are somewhat remote from the hospital.
But it won't do any good if there's no vaccine to administer. Production of the H1N1 vaccine has been slower than expected, and until all 30 million doses are distributed in the next few weeks, healthcare workers are forced to ration.
We did not even come close to receiving the amount that we anticipated.
National emergencies are usually declared over major disasters or national security issues. This is the first time such an emergency has been declared over a virus. Kate.
Okay, Rachel Martin, thank you. And we are joined now by our senior health and medical editor, Dr. Richard Besser, who, of course, used to be the acting director of the Centers for Disease Control. So you know this stuff inside out. Good morning.
Good morning.
So why now? Why would the government declare an official emergency now?
You know, although their statements are saying it has nothing to do with the number of cases, I think it has everything to do with the number of cases. What they're reporting is more flu activity now than they would ever see this time of year. The flu activity is similar to the middle of flu season, so what you would see in the middle of January, February. Certain areas are getting slammed, and what this provides is the flexibility for a hospital to say, we want to do things differently. We may want to set up a flu clinic in an empty building. We may want to be able to treat patients a little bit differently than we otherwise would. Without having both the declaration of a public health emergency and a national emergency, hospitals would not be able to do that and get compensated for that care.
Is it kind of a catch-22 for the government, though? If they declare an emergency, everyone goes, oh, no, an emergency. But if they don't, then they don't have the gear.
You know, I think that this is an extremely challenging communication issue for the government. On the one hand, the vast majority of people who get this flu have mild illness.
Right.
They recover in a few days, but not everyone. You know, we hear these tragic stories of people who die from this flu. So how do you convey the fact that this is serious? We need to take this seriously, but it's not a 1918 pandemic.
Right. So I would think you would say to our audience not to panic just because an emergency has been declared.
Yeah, what I would say is that, you know, vaccine is coming. It's definitely not where anyone had hoped it would be at this time. There are only 11 million doses that have been distributed out of a total of 250 million that are coming. Do those things to protect your health that you can, but this is not a flu like 1918. This is the flu.
And as far as the vaccine, because you mentioned it again,
right.
I got to go back there. They were supposed to have as many as 120 million doses, they said, by mid-October. And I believe as of Wednesday, we're at 11 million. That's far
right.
short of where we thought we would be. So will the emergency declaration help that process at all? Will it get more vaccine out there, or does it have nothing to do with it?
It has absolutely nothing to do with speeding up vaccine. You know, vaccine production relates to how fast that virus grows, because it has to grow up to make a vaccine. That's right. And the production of turning that then into the vaccine. And this will not help that at all.
So where are we in terms of the vaccine then? Do you think?
Well, it's coming. You know, the stories that we're reporting of clinics with long lines and shortages and people looking for it. I get calls daily from friends who think I have an inside route. My
Do
kids,
you?
no, my kids haven't been able to
I'm
get
looking for it
vaccinated
too.
yet either. So it's coming, but not nearly as fast as anyone would like. You know, the word is by mid to late November, but I don't think anyone really knows for sure when there'll be enough to meet the demand.
But it's still worth doing, even if it's mid to late November.
That's right. You know, with a pandemic, they come in waves. There was a spring wave. We're in the middle of a fall wave. There likely will be further waves, maybe this spring and even into next year. So vaccinating will be helpful.
Dr. Richard Besser, thanks as always.